Hello and good morning. Thank you so much for joining us today. My name is Dana Hayes, and I am the Development Associate here at Friendship Bridge. And we are going to go through our 101, which will provide a brief description of our program, our services, and our future plans. So, Friendship Bridge. Our vision is empowered women choosing their own path. And the way we do that is through vehicles such as microfinance, education, and health services. All of these things combine to empower Guatemalan women to build a better life. And that is what we do. So microfinance or microcredit is an effective global development strategy in areas of the world where people lack access to formal financial systems. It gives small loans to expand businesses, and it breaks the cycle of poverty. Many of our clients run small micro enterprises such as weaving, raising livestock, or making handicrafts. And no matter how small a business is, it still needs investment to grow. Microcredit puts capital into the hands of the poor so that they can purchase supplies, invest in their businesses, and generate a profit. Our average first loan size is $380. It's a seemingly small amount, but it can make a big difference to women in Guatemala. Guatemala is one of the poorest countries in Latin America and the Caribbean, having highly unequal incomes and chronically malnourished children. They are beset by political insecurity and lacking skilled workers and infrastructure. All of this creates a dependency on remittances for nearly 15% of GDP. Despite a pre-pandemic stable and growing economy, there has been a minimal shift in the number of those living in poverty, with current reports of the number living in poverty actually rising, and a disproportionate amount of that demographic being Indigenous. Indigenous peoples actually make up 39% of the overall population of Guatemala, but 79% of them live in poverty. We also know that women make up a large portion of those living in poverty. And in Guatemala, high rates of violence and discrimination against women and Indigenous populations tells us that they are doubly affected by a lack of opportunities, resources, and finances. We also knew it was going to take time, patience, and determination to gain their trust. So our data over a 23-year history in Guatemala tells us that microfinance has us on the right track to succeed in our mission. And our learnings from this approach informed our new plan, in which we'll create a segmented organizational structure to provide specialized services to two distinct client segments. Dreamers are women living in poverty, mainly in rural areas, and looking for access to financial services to support a variety of productive economic activities, otherwise known as necessity-driven entrepreneurs. This segment is characterized as hard to reach, with many of the small loans offered through our group lending methodology. The Dreamer client segment will continue to comprise a majority of our clients moving forward. Our theory of change for this segment will focus on improving clients' resilience and empowerment to positively impact her family. Altogether, we expect that every Dreamer client we support will impact 6 people beyond our reach. We're prepared to serve Dreamer clients by adopting new technologies to improve our efficiency, reach more clients, and expand holistic services. Meanwhile, entrepreneurs are women looking to start or expand a business who are living in vulnerable circumstances, but are willing to assume some financial risk. They're highly motivated and capable of growing high-functioning businesses, creating jobs, and becoming leaders in their communities through the operations of livelihood-sustaining enterprises. We plan to empower more than 1,000 women entrepreneurs by 2025 with the Bridge to Success or Puente al Éxito program. Because this client segment is highly variable, we will offer personalized products and services focused on business growth and employment. New and graduating clients will access individual loans structured in a way that responds to their business opportunities and capacity. And they'll also receive personalized advisory services, connections to peer networks, and access to markets. Although this segment will represent a smaller portion of our total clients, we expect their impact to reach far beyond their families and extend to employees and a larger community. Our Dreamer client segment is our group of clients operating under our flagship model of microfinance, education, and healthcare. So let's look at their services first. Trust banks use social collateral to reduce delinquency and ensure participation. Trust banks are small groups of women who come together and co-guarantee each other's loans. Dreamer clients self-select into these groups, which range in size from 7 to 25 members. The trust banks meet monthly to make loan repayments with a network of support and accountability for loan repayment. And it works. In a highly competitive market, 85% of Dreamer clients say that they could not find a good alternative to Friendship Bridge, and we maintain one of the highest quality portfolios in Central America. This loyalty is proven by the fact that nearly 95% of clients were making their loan repayments by the end of 2020. Another thing we do differently is that we don't rely on microcredit alone to alleviate poverty. Over time, we have grown with our clients and developed the Plus services that are benefits of being a client with Friendship Bridge. These Plus services, education, health services, and advanced skill set training, have a multiplier effect that accelerate the reduction of poverty rates among our clients. On average, clients who are with us for 6 years or more experience a 20% reduction in poverty rate, which tells us that the longer a client is with us, the better off she is, because the Plus services help her to bear the burden of extreme poverty. The first of the Plus services for the Dreamer segment actually applies to each and every client in the organization, and that is education. The non-formal education program focuses on 4 pillars: family, women's rights, business development, and health. The lessons are delivered monthly when clients make their loan repayment. Our educational curriculum is unique and responsive to our clients' needs. It takes into consideration topics requested by clients themselves through surveys and a client advisory committee. The lessons are interactive and they're delivered through illustrated flip charts to accompany any text, so our clients who can't read or write can follow along. Additionally, our facilitators, loan officers, are the same local people in the communities that the clients that we serve, and speak Spanish and the same local indigenous language so the clients can understand the lessons. We believe that a microloan can be an effective hand up, but education is an asset for life. By combining education and training with loans, we can help our clients build a solid foundation for a pathway out of poverty. One of the specific skill set training programs for our farmer clients is called Agriculture, Credit, and Training. The agriculture sector accounts for 13.5% of GDP and 31% of Guatemala's labor force. This program started as a pilot with 40 clients in 2016 and now hosts 692 participants as of November 2020. Clients opt into the program, agreeing to attend and participate in technical trainings directed specifically to women farmers. As a first of its kind in Guatemala, the women are offered personalized technical assistance by Friendship Bridge agronomists, group trainings, and field days at our demonstration plots, where they learn about modern agricultural practices in order to increase yields and utilize improved farming techniques, such as crop rotation, pest control, and accessing markets to achieve the best prices for their products. In 2017, it was reported that our clients had 57% more crop yields than prior to joining the program. In 2019, a professor from the University of Toronto revealed in a study that participants in the agriculture program seem to show greater participation in production and decision-making than other women farmers in the area who did not participate in the program, showing a higher level of empowerment. Participants in the agriculture program have also been recorded to have more savings and higher incomes than other women farmers in the area who do not participate in our programs. Health services. So imagine needing medical attention, but in order to get it, you have to give up a day's income and spend money on transportation to the nearest clinic, which might be quite a ways away. On top of that, you don't speak the same language as your doctor. If they prescribe a medication, treatment, or surgery, you don't know what it's for, and you have to decide if you want to spend the money that you have on this mystery treatment or on food and other necessary supplies. For many people in Guatemala, these stacking frustrations are the norm when it comes to medical care. Between these challenges and rampant misinformation about what is the cause or effect of treatment, Many clients of ours will actually forego medical care for preventable diseases like diabetes, hypertension, and cervical cancer until situations are really very dire. In order to address this, Friendship Bridge offers health services, utilizing our already established trust bank infrastructure and rapport with the clients to provide education, guidance, and annual health screenings at no cost to them. Health services are provided via mobile clinics that travel to the villages where the clients live. The clinics are delivered by trusted and culturally sensitive female nurses, and they're designed to address the constructs that influence whether a client participates in health screening, recognizes any symptoms, and engages in necessary treatment or follow-up. If or when a complex health case is discovered, clients are provided with patient navigation services by the nurses that they know. Through these services, prevention and early detection, especially with diabetes and cervical cancer, as well as access to family planning, can help women stay in the workforce, keep household expenditures low, and increase their position in their family, community, and society. By building women's empowerment through Health for Life, Friendship Bridge is effectively reducing poverty in these underserved communities. As we discussed earlier, the entrepreneur clients are those business owners who are prepared to take on a bit more responsibility and risk, but still struggle to gain entry to traditional capital and banking systems. These women make up the missing middle of financial inclusion. While we've developed the Puente al Éxito Bridge to Success program to provide them with individual loans that will help them reach their full potential, they're still going to need support and plus services of their own. These clients will have access to one-on-one business development and mentor services through this program, with a focus on helping them expand their peer-to-peer connections. One place where you'll find these entrepreneur clients is in Handmade by Friendship Bridge, previously known as our Artisan program. Handmade by Friendship Bridge is a program that pertains specifically to artisans. Participants gain the skills and experience needed to create and sell their products to local, national, and international markets. By acting on this opportunity, the artisans who participate in this program are empowered to design and produce ready market products, improve their livelihoods, and ultimately help alleviate the effects of poverty in their families and communities through business expansion. For entrepreneurial clients, the program provides network support, direct relationships with wholesalers and suppliers, and for dreamer clients, we provide technical assistance. Handmade by Friendship Bridge acts as a client's first international wholesale buyer, featuring their products on our online store, which allows the program to be self-sufficient. Guatemala had its first confirmed case of COVID-19 on Friday, March 13th, 2020. Immediate lockdowns and other preventive measures were put into effect. Over the course of the weekend, our staff moved out of their offices and into their homes in order to work remotely and find safe ways to support our clients. Starting Monday, March 16th, our staff rallied together to make phone calls to our clients in multiple Indigenous languages to ask what they were experiencing, what we could do to support them, and how much they and people in their community knew about COVID-19. We then fast-tracked the launch of our developing intranet, Mi Puente, in order to keep homebound teammates connected, learning, and focused during lockdown. Non-formal education continued via phone calls and videos in order to educate clients around health, safety, and resources during lockdown, including how to take advantage of a 2-month grace period we offered all clients. Health for Life shifted to telehealth services with a call center staffed with nurses who made outbound calls with critical health information and were available for any client to call for information or guidance around COVID-19 or other chronic illnesses. Preliminary results show that clients are more willing to participate in health services in 2020, with an estimated 65% participation rate versus a 43% participation rate in 2019. We started offering private home visits from nurses for clients as well, and have seen a 27% increase in demand for annual health screenings this year. Handmade by Friendship Bridge developed cloth face masks for clients to make and sell both locally and internationally, and launched live shopping events, making the most of a global turn to e-commerce and leading to a sales increase of 6.5 times that of 2019, oftentimes providing the sole employment for these clients over the summer of 2020. We raised over $65,000 in 60 days to feed 15,000 people, an enormous undertaking facilitated by partnerships with other organizations such as Unispice and Procter & Gamble. Friendship Bridge entered 2021 on a higher note than expected. By the end of 2020, we had that 95% repayment rate, and we've clocked over 13,000 hours in continuing education for our teammates, providing more resources and skills to serve our clients. Sadly, however, Friendship Bridge continues to be the exception, not the rule in Guatemala. COVID-19 continues largely unchecked in Guatemala. Forced to reopen for the sake of preventing economic collapse, many in Guatemala are still at risk of COVID-19, with case counts at the beginning of August peaking well above any other wave and a mere 16% approximated vaccination rate. However, over 90% of Friendship Bridge staff in Guatemala are vaccinated. Logistical issues have ranged from vaccine cold storage to limited facilities for administration. Friendship Bridge clients have little to no access to vaccines if they cannot register via the government-run website, for which you need internet access and the ability to read and write. Luckily, as so often before, Friendship Bridge is in a position to utilize the trust and infrastructure that we've created to help bring equity to this situation. This year, from August to November, the education modules will focus on COVID-19, giving clients a safe and trusted place to ask questions regarding their vaccines, and to allow our facilitators the opportunity to aid them in registering on the National Vaccine Registration website for those clients without internet access or literacy capabilities. We're also celebrating the launch of our new 5-year strategic plan, Impact Squared. This will be the first time we'll expand our strategic plan to a 5-year format, and we have the new strategic initiatives to guide the way. First is responsible growth. We're looking to expand to 6 branches in the 5-year plan in places where our work will make the most impact. Then, continuing our successes in technology, our social performance team has just launched a call center for all client inquiries, creating more direct and open communication. We're going to continue offering continuing education for our employees through Friendship University, an opt-in learning center inside our intranet, and we're incorporating scannable barcode systems to process Handmade by Friendship Bridge production better and sell to larger retailers. We're also rolling out the new program, Puente al Éxito, or Bridge to Success, which is the formal program name for our entrepreneur client segment, and we look forward to seeing this program take off during its initial plan session. And finally, we're remaining committed to our social impact. For the 2nd year in a row, Friendship Bridge is listed as a great place to work in Latin America and the Caribbean, meaning our teammates rated their managers and organization highly in a third-party hosted anonymous culture and work environment survey. And we're continuing on with our 4-star rating from Charity Navigator, meaning that we have high transparency and fiscal responsibility. And that concludes our quick overview of our programs and structure. Most of you are here today because you've already made a donation or a purchase, but if you're looking for other ways to get involved, we do have a lot of options available. Thank you so much for joining us today. I really hope that we've answered some of your basic questions around our programs and services. If not, please do feel free to give us a call or an email, and we'll be happy to talk with you one-on-one. Have a great day. We'll see you next time.